If you don't like complicated procedures but still want to excel in clinical practice, then follow this clear and simple guide to male catheterization. Start by introducing yourself to the patient. Clarify his identity, explain the procedure, and get his consent. Make sure you have all your equipment. Catheterization pack, a 12-14 FR Foley catheter bag, antiseptic solution, sterile gloves, lignocaine gel, and a 10 ml syringe filled with sterile water. Position the patient on his back with legs slightly apart, lying as flat as possible. Open your catheter pack using a septic technique and pour the antiseptic solution into the receiver. Wash and dry your hands, then put on sterile gloves. Drape the patient and place a collecting vessel between his legs. Hold the penis with a sterile swab and thoroughly clean it, retracting the foreskin to clean around the urethral meatus. Insert the lignocaine gel into the urethra and hold the meatus closed for 5 minutes to let the anesthetic work. Hold the penis vertically with one hand and using the other hand, advance the catheter tip from its sleeve and insert it into the urethra. Continue inserting until urine starts to flow into the collecting vessel. Inflate the balloon with 10 ml of sterile water, ensuring it doesn't cause pain. Attach the catheter bag. Gently pull on the catheter until resistance is felt, then reposition the foreskin. Dispose of your gloves and equipment, and wash your hands. Finally, record the volume of urine collected and ensure the patient is comfortable and covered. And there you have it, a complete tutorial on male catheterization. You've got this. Let's delve deeper into each step to ensure you have a thorough understanding of the process. First, it's crucial to establish a rapport with the patient. This not only helps in gaining their trust, but also ensures they are comfortable and less anxious about the procedure. Explain the procedure in simple terms, addressing any concerns or questions they might have. This step is vital, as it sets the tone for the entire process. Once the patient understands and agrees, obtain their written consent. This is a legal requirement and also a good practice to ensure transparency. Now let's talk about the equipment. Having all the necessary tools at hand before starting the procedure is essential. This includes the catheterization pack, a Foley catheter, a catheter bag, antiseptic solution, sterile gloves, lignocaine gel, and a syringe filled with sterile water. The Foley catheter is typically used for this procedure. It comes in various sizes, but for adult males, a 12-14 FR catheter is usually appropriate. The size may vary depending on the patient's anatomy and the clinical situation. The antiseptic solution is used to clean the area and reduce the risk of infection. It's important to pour it into a sterile receiver to maintain aseptic conditions. Hand hygiene is paramount. Wash and dry your hands thoroughly before putting on sterile gloves. This step cannot be overstated as it prevents the introduction of pathogens during the procedure. Positioning the patient correctly is also crucial. The patient should lie on his back with legs slightly apart. This position provides the best access to the urethra and makes the procedure easier to perform. Drape the patient to maintain a sterile field, and place a collecting vessel between his legs. This vessel will collect the urine once the catheter is inserted. Cleaning the penis with a sterile swab is a critical step. Retract the foreskin to expose the urethral meatus and clean thoroughly. This reduces the risk of introducing bacteria into the bladder. Lignocaine gel is used as a local anesthetic. Insert it into the urethra and hold the meatus closed for about 5 minutes. This allows the gel to numb the area, making the procedure more comfortable for the patient. When inserting the catheter, hold the penis vertically with one hand. This straightens the urethra and makes the insertion smoother. Use the other hand to advance the catheter tip from its sleeve and gently insert it into the urethra. Continue inserting the catheter until urine starts to flow into the collecting vessel. This indicates that the catheter is in the bladder. Inflate the balloon with 10 ml of sterile water. This balloon holds the catheter in place. Ensure that the inflation does not cause any pain to the patient. Attach the catheter bag to the end of the catheter. This bag will collect the urine and should be positioned below the level of the bladder to ensure proper drainage. Gently pull on the catheter until you feel resistance. This ensures that the balloon is properly seated in the bladder. Reposition the foreskin to its original position to prevent any complications. Dispose of your gloves and any used equipment in a proper biohazard container. Wash your hands thoroughly to maintain hygiene. Finally, record the volume of urine collected. This information is important for the patient's medical records. Ensure the patient is comfortable and covered before leaving. Reassure the patient and let them know the procedure is complete. Answer any questions they might have and provide post-procedure care instructions. Document the procedure in the patient's medical records, noting any observations or complications. This ensures continuity of care and provides a reference for future medical interventions. Maintaining hygiene throughout the procedure is crucial. Always follow aseptic techniques to prevent infections and ensure patient safety. A clean and organized workspace is essential for efficient and safe medical practice. Always prepare your tools and environment before starting any procedure. And there you have it, a comprehensive guide to mastering male catheterization. With practice and attention to detail, you'll become proficient in this essential clinical skill. You've got this!